Hello and welcome. My name is Dr. Camargo. I'm a family nurse practitioner here at CHAS Center. This month, we are celebrating National Women's Health Month. The topic for the Wellness Wednesday Live is urinary incontinence. Our goal is to talk about the health and wellness resources, as well as ways to access the support that can help you and your family get and stay healthy. Wellness Wednesdays Live are held the second Wednesday of each month in English and the third Wednesday of each month in Spanish. Help us reach others who may benefit from this information by sharing and tagging them on the post. While we wait for others to join the live stream, we will tell you a little bit more about what is happening in our program. For Women's Health Month, we are focused on ending the pandemic and elevating women's health. We want to encourage all women to take care of your physical and mental health. Continue to protect yourself from COVID-19 by wearing a mask that covers your nose and mouth. Continue to social distance, so staying 6 feet from one another. Remember to wash your hands often and get your COVID-19 vaccine if you are of age. Our center is holding multiple vaccination clinics, both at the center as well as throughout the community. Please contact us to schedule your vaccine or find a vaccination provider that is most convenient for you. We will give everybody a couple more minutes to see if who wants to join, and then we will get started. Well, I think we've given individuals enough time to join us, and now we can get started. Don't forget to type your questions in the comments section, and we'll answer them at the end of the presentation. You can also feel free to refer to our website at chascenter.org if you have any questions that were not answered in this presentation. So we're going to be starting urinary incontinence. So there are 4 types of urinary incontinence. You have urinary incontinence that is referred to or defined as leaking of urine that you can't control. Urinary incontinence is not just a medical problem. It can affect an individual emotionally, psychologically, and it can affect their social life. Many people don't talk about having urinary incontinence as they are afraid to do so or embarrassed. Urinary incontinence can keep people from enjoying their life. Many people think it's a part of getting older and don't know that they can be managed or treated. So when we talk about urinary incontinence, there are 4 different types. You have your stress incontinence, which is when you leak urine when you're doing normal activities such as coughing, laughing, sneezing, or exercising. That's what we call stress incontinence. You have urge incontinence, which is when you leak urine after feeling a strong urge to urinate. And then you have your mixed urinary incontinence, which is when you have a mix of both stress and urge incontinence. And this is when you leak urine when you laugh or sneeze and it comes out. And then you have temporary incontinence, which may be related to an illness, related to urinary tract infections, or if you are pregnant, sometimes this can happen too. How common is it? So we don't know for sure how many women experience urinary incontinence because, like I said, it's something that most people don't talk about, are embarrassed to either bring up to their family members or even their providers. So many people do not report it, and many people don't know that there are treatment options for it. 1 in every 3 women usually is affected by urinary incontinence. And then 2 out of every 3 women that have urinary incontinence do not consult their providers. So let's talk about what normally happens with the urinary system. So here we have a graph. So when an individual has to urinate, the brain and the bladder control the urinary function. So the bladder stores the urine until you're ready to empty it. The muscles in the lower part of the pelvis hold the bladder in place. Normally, the smooth muscles of the bladder are relaxed. This holds the urine in the bladder. The neck end of the bladder is closed. The sphincter muscles are closed around the urethra, and the urethra is the tube that carries urine out of the body. When the sphincter muscles keep the urethra closed, urine does not leak. Once you are ready to urinate, the brain sends signals to the bladder. The bladder muscles contract. This forces the urine out through the urethra, the tube that carries the urine from the body, and the sphincters open when the bladder contracts. So this is like what normally should happen. So for individuals with stress urinary incontinence, they have weak pelvic muscles that let urine escape. So it is one of the most common types of urinary incontinence. So this happens when the pelvic floor muscles have stretched. Physical activity puts pressure on the bladder leaks. Leaking may happen when you exercise, when you're walking, when you're bending, lifting, or even sneezing or coughing. It could be a few drops of urine or even as much as a tablespoon of urine that leaks out at any given point. Another common stress urinary incontinence is overactive bladder. Overactive bladder is another common type of urinary incontinence that women may have. It is also called urgency incontinence. It affects more than 30% of men and 40% of women in the United States. It affects people's lives because it restricts their activities. They may fear they will suddenly have to urinate and are not near a bathroom, and therefore restrict their social life and going out with friends and family. With an overactive bladder, your brain tells your bladder that it needs to be emptied even though it is not full. Or the bladder muscles are too active, making you think that you have to urinate. They contract, squeeze to pass urine before your bladder is full, and this causes you the urge to urinate even though you don't have a full bladder. You can't control or ignore this if it's a feeling that you got to go, and this makes you constantly go in and out of the bathroom, even though you may not be urinating a lot every time you go. This type of urinary incontinence is more common in women who have experienced menopause, and they report usually that they're frequently urinating and it's not a lot of urine. So common causes of stress incontinence could be related to the side effects of medication, certain foods, weakened pelvic floor muscles. The most common one that we see is after pregnancy, after having a baby. With age, severe constipation can also lead to urinary incontinence, and then changes in body after childbirth or surgery. So there are self-treatments that you can do at home. One of the biggest factors that it can affect is being overweight. So maintaining a healthy weight. People who are overweight or obese are more likely to develop stress urinary incontinence. Losing weight reduces the severity of the stress to the urinary or bladder area, and therefore puts less pressure to that area. Many people find that losing just 10 pounds can lead to fewer leaks. You always want to consult your healthcare provider to find out what your ideal weight is for your height and age, and that together you can create a safe way to lose and maintain a healthy weight. Maintaining good bowel function is another key factor. Constipation can make incontinence worse. Try to prevent constipation. Eat a high fiber foods such as fruit, beans, dark colored vegetables, and encourage regular bowel movements. It helps if you drink 6 to 8 glasses of water each day and if you exercise daily. There are also vaginal pessaries. The vaginal pessary is a form yet flexible device that is inserted into the vagina. It is repositioned and supports the urethra to help prevent leakage. Prescription pessaries are small and often made of medical grade silicone. These must be fitted just by your specialist, and they are inserted into your vagina. Your pelvic floor muscles hold it in place. It must be fitted properly. You won't notice it if it has been done properly. And it helps so that you can continue to do your activities of daily living comfortably. Your healthcare provider can remove it, check it, and replace it as needed. And they'll teach you how to remove it and reinsert it if needed. So that would be something that you could talk to your healthcare provider if you're really suffering and notice that your incontinence is getting worse. There is something that we can help you do or refer you to a specialist to seek more help. There are surgical options. And again, that would be something that you would have to discuss with your healthcare provider to see which option is best for you, depending on how bad you feel your incontinence is. Kegel exercises are a great way for you to tone your muscles. So these aid in the muscles that help control your urinary control and give you more of a like strength to avoid having leakage. So for more targeted approach, it is crucial that you focus on your Kegel muscles exclusively. You might find it difficult at first, especially if you have a weakened pelvic floor, but after a few weeks, you'll see that you'll start noticing some improvement. Kegel exercises should be done for 8 to 20 weeks in order for you to notice some improvement. You want to combine both fast and slow exercises, aiming to perform them for about 5 minutes, 3 to 5 times per day. Anyone who has had recent surgery, or if you recently had a baby, you want to consult with your provider before starting any exercise regimen. And here on the picture, you can see there's different ways to do them. You can do it as the bridge, where you lay back and inhale and squeeze when you lift your pelvic floor. There's the wall squat. And this one, you stand against the wall, feet hip width apart. And inhale, squeeze, and lift your pelvic floor and lower yourself into a squat. And you would hold this for 10 seconds. You have the slow Kegel exercise. On this one, you would sit, stand, or lie with your knees slightly apart. You would slowly tighten your pelvic floor muscles, starting with your anus, tightening around your vagina and squeezing both areas as hard as you can and holding it again for 10 seconds and then letting it relax. And then we have what is called the fast Kegel exercises. And those you would sit, stand, or lie with your knees slightly apart. You would quickly tighten your pelvic floor muscles, starting with your anus, tightening around your vagina and squeezing both areas as hard as you can and lift. You will hold this for 2 seconds and then you would relax. So how to know how bad if you have mild, moderate, or severe urinary incontinence? Well, we would ask you to keep your like a bladder diary. So bladder diaries are a good idea to help you identify what kind of treatment regimen you need, both you and your provider. This is a good tool to track your day-to-day symptoms. In your diary, you would write down the fluids you drink and how often you go to the bathroom. You also need to know when you have leaks, include what you were doing when the leak happened, such as where you were running, coughing, sneezing, and then how much you feel leaked at the time that the accident happened. The symptoms you notate, you would want to share with your healthcare provider, and together you guys would come up with a treatment plan to see what option is best for you. Again, we want to thank you for joining us this month for Wellness Wednesday Live and helping us connect with others. If anyone has any questions, you can put them in the comments below and we will answer them for you. So if you have any other questions or think of anything that you might answer, you can always call our center or go to chatcenter.org and enter your questions there. If anybody would like to be seen for this, please call our center to make an appointment. We wanted everyone to stay healthy and remember to get your COVID-19 vaccine. Have a great day.